vaccination opponents gathered at the New York State Capitol Tuesday. They're trying to fight a bill that would end religious exemptions for vaccinations. This comes as the U.S. is in the middle of its worst measles outbreak since 1994. The biggest of those outbreaks are in New York. Health officials blame the crisis on a well-funded misinformation campaign. CBS News Chief Medical Correspondent Dr. Jon LaPook reports.
How many people in this room do not believe that the information coming from the Centers of Disease Control is correct about vaccines?
Protesters converged on the Capitol building in Albany, New York today, meeting with state legislators. They are trying to kill a bill that would remove non-medical exemptions for school vaccinations.
But the rabbis tell us that there's nothing in Judaism that prohibits vaccination.
It doesn't matter.
Questions were met with heated responses.
Well, the question, I guess, that Pete
Think of the Disneyland outbreak. These people are not dying. The herd immunity.
Most of the measles cases in New York have occurred in Orthodox Jewish communities, where an illustrated magazine known as the Peach Pamphlet has been circulating. Public health officials tell us the pamphlet is specifically targeting this community. The pamphlet falsely links vaccines to autism. The overwhelming consensus of the scientific community is that vaccines do not cause autism. The pamphlet's cover says it is a project of parents educating and advocating for children's health, or PEACH. That organization's website posted a statement saying it had nothing to do with the pamphlet, even though it hosted a copy on its website until last month. We found this address listed for PEACH, but nobody there knew anything about the group.
Doesn't sound familiar?
Some of the more established names at today's rally included Robert F. Kennedy, Jr. Recently, some of his family members disavowed his views about vaccines. And Del Bigtree, a leading voice questioning vaccines. Back in March, he used Holocaust imagery to align himself with vaccine skeptics in the Orthodox Jewish community.
For all the Hasidic Jews in New York right now that never thought this moment will come, I am saying, I stand with you.
Bigtree's funding has grown.
Where do you get your funding? What's the largest donation?
I would say that we are being donated to by lawyers, by doctors, by scientists, by entertainers that all believe that this is a discussion that needs to be discussed.
We took a look at the most recent tax filings available for his organization. In 1 year, contributions went from a little over $100,000 to more than $1.4 million.
Dr. Jon LaPook joins me now. So this issue is so highly charged.
Sure.
The health commissioner says that the Peach pamphlet has been circulating for years. Why are we only now seeing more people choosing not to vaccinate their children?
Well, you're having these pockets of communities, and the Orthodox Jewish community is one of them, that were sitting there waiting, like kindling, to go up. And in this case, there were some people who were infected with measles who traveled over to Israel, who came from Israel, and they set off the fire. So it's unpredictable. Same thing happened with the Somali community in Minnesota. Unvaccinated people just waiting for the virus to come in. The virus is so infectious. If you're not immunized against it, if you're unprotected, then one person can infect anywhere from 12 to 16, and there's about a 90% chance you're going to get infected if you're near that person.
So you mentioned in your piece most of the measles cases have been, in fact, centered around Orthodox Jewish communities, and that they have been targeted by Peach. Why are these communities specifically the target of this organization?
All right. So, Elaine, I know actually a lot more about this now than I did before I did my a couple of pieces that we've done for the Evening News and CBS This Morning, because we've interviewed some Orthodox Jewish rabbis, and they've explained that there is nothing in Judaism that prohibits vaccination. But then they go on to say that what's going on with these communities is the Orthodox Jewish community is pretty insular, right? Many of them don't have access to the internet, to television, to iPhones. So if somebody slips the Peach pamphlet under the door, or they hear a robocall, or they call these hotlines, which I did last night, by the way. I listened for about a half hour, and a lot of it is just wrong. But if that's your only source of information, That's your
There's
source of
nothing to
information.
counteract
Nothing
that
to counteract
message.
it. And then you go into synagogues, and you're congregating with a number of other people, and by the way, you're spreading not only the misinformation, but potentially the virus if somebody's infected.
So we've seen this measles outbreak become a nationwide problem.
It is.
How are officials tackling specifically that spread of false information?
So with information, with real facts, and more than that even, it has to be a change in approach. So one of the things that I've really come to believe and to witness is that you have to identify common ground. So what is the common ground here? The common ground is obvious, Elaine. We all love our children. We would do anything for our children. And in fact, you would probably jump out into traffic and risk your life to save a 5-year-old who you don't even know from getting hit by a car.
Sure.
So what is that? That's evolutionary wiring, protect the species. So let's go from there. Let's start from there and then say, well, what went wrong? Why do some people believe this and other people believe that? And avoiding the false equivalency. This is not like, well, there are some people who believe the world is flat and there are some people who believe the world is round. Okay, the world is round. So we can't give too much attention and credence to things that are anti-science. At the same time, we have to really carefully explain in a non-judgmental way, in an understanding way, with a soft voice and with a lot of patience, what the real facts are. Tell me, if you're a parent who's vaccine hesitant, what are your concerns specifically? And let me take the time. You don't have the time, 10, 15 minutes in a doctor's office. It may be seminars like we saw in Boost in Oregon, where there was this organization where Dr. Joel Amundsen, I hope people can see the CBS Sunday Morning piece that we did a few days ago. He spends an entire evening explaining to people what the story is.
Right, because that was going to be my question. When you are confronted with someone who is very steadfast in their belief that vaccines have hurt their child, that is an emotional, guttural sort of response. What is the best way to engage a parent who believes that the science on this is not settled when you say the science absolutely is settled?
Right. Well, one of them is to understand where they're coming from. If you're a parent and you believe that your child was injured, that's a big deal, okay? And in fact, that's going to be your duty to prevent some other kid from being injured. So start from there. And now, it ain't easy to pry belief away from somebody.
Sure.
It hurts. Remember when you found out there was no Santa Claus?
Sure, right.
That's a belief that gets punctured. I'm serious. Remember what it felt like. We've all had beliefs in our lives punctured. You know, what that feels like. So you have to really be careful, be empathetic, be communicative, be patient, and then one by one with science, we have to ultimately believe in science. It can't be just whatever belief, this is my feeling. There is science, there's a scientific method, and there's a lot of studies. And you know what? Doctors, pediatricians, doctors, clinicians need to do their homework because there is such a boatload of really overwhelming literature out there. I've actually gone through much of it because I've had to do pieces and I've wanted to do pieces, but I tell you, it's a little overwhelming to go through it. So I understand probably a lot of people don't have the answers. You got to bone up, learn the answers to these questions.
Well, there's so much misinformation out there. It's good to hear there's some common ground in the way in which we can all begin to talk about this. Dr. Jon LaPook, Jon, thank you very much.
Thanks a lot.